Wash your hands. Cover your nose and mouth when you sneeze. Avoid large crowds. But in addition to all these novel coronavirus precautions, there's a crucial item missing, something we all touch over and over again every day: our phones. Few of us can live without our smartphones, but they're often the forgotten link between public services and our face.
And also to be mindful of the things that you commonly touch. And the most common thing that you touch is your phone. And you might want to make sure that you clean the surfaces of your phone as well as you touch it. It's subconscious, we often do that, but these are the important things to make sure you protect yourself.
Let's take a look at just my daily commute. If I'm taking the bus, there are the handrails and the stop button. Of course, all while I'm checking my emails and tweets. Calling for the pedestrian signal and into the office, where I've got 2 sets of doors to open, with my pass that I touch dozens of times a day, and a stairway to climb. Straight off, I need some caffeine, with a dash of milk, before my workday has even begun. I touched public surfaces a total of 11 times and my phone a total of 4 times, just on my commute in. Our phones can be hotbeds of bacteria, effectively a petri dish in our pockets.
There's probably quite a lot of microorganisms on there because you're holding them against your skin, you are handling them all the time, and also you're speaking into them. And speaking does release droplets of water just in normal speech. So it's likely that a range of microbes, including COVID-19, should you be infected with that virus, might end up on your phone. So giving your phone a clean would be not a bad idea at all.
So how should we be cleaning our phones without damaging them? Apple recently updated their guidance saying you can wipe your phone down with either disinfectant wipes or 70% isopropyl alcohol. Other phone manufacturers recommend a mixture of hand soap and water and a soft microfiber cloth. What they recommend is that you take one of these wipes, wipe down the hard surfaces of your phone while trying to avoid any sort of open ports like the charging port or a headphone jack. Or if you want to be a little bit high-tech, you can try one of these ultraviolet sterilizers. What you do is you pop your phone in for about 10 minutes and let it zap the germs. But it's not clear yet how effective these are on coronavirus. Considering my iPhone tells me I pick up my phone an average of 205 times a day, the latest front in battling the coronavirus may be in your hands right now. For CNN, I'm Hadas Gold in London.
Doctor, what is happening in this machine that has 31 minutes and 55 seconds to go?
So what's happening here is the last step in our process for testing for the virus.
Doctors and researchers at the University of Nebraska Medical Center in Omaha await results of a new test they've developed that could speed up the fight against the novel coronavirus.
How quickly will you know if any of the patient's information in here is negative or positive for coronavirus?
We will know immediately.
The test, which was fast-tracked for approval by the FDA earlier this month, comes as the World Health Organization declared COVID-19 a global pandemic. The lack of access to testing here in the United States has become a point of contention and confusion. But some research hospitals, like the University of Nebraska Medical Center, are continuing to expand their capacity to do on-site testing so that patients who come in can learn the results that same day.
So if you get tested here by your new protocol that's been approved, how long will it take for you to get the results?
So the results are available within 4 to 6 hours.
And that's remarkably different than other testing I've heard, right, which takes days.
That's right. And that's really all about our ability to perform the testing here in our local laboratory.
The doctor believes to get faster results, the entire testing process should happen at the medical facility where the test is being administered.
You know, across the country, we are still dealing with the challenges of it taking sometimes days to get a test result. A lot of that does have to do with the proximity of the laboratory doing the testing. Sometimes that laboratory is not even in the same state. It is truly a huge advantage to have testing at your own institution.
Back in the lab, doctors are looking at the results of the 20 tests they conducted just hours earlier.
Tell me what the results were of the testing.
So I'm happy to report that today our first batch of results is all negative. So we're going to be able to convey those results to the clinicians caring for these individuals who may be sitting in our emergency room right now waiting for their result.
How many positives did you expect to see?
I expected 3 on this run today.
3 out of the 20?
Yeah.
And you got 0?
0.
So you're grateful?
Very grateful.
Scientists consider this a worst-case scenario. Humanity tightly packed and under threat from pandemic spread.
You could have, in some circumstances, hundreds of people just to one tap.
To one tap, yes.
In the informal settlements of Tembisa, health advocate Mpho says that even basic protection from the virus, like washing your hands, is unrealistic.
So people talk about simple solutions to prevent this, but they're not that simple here.
They're not that simple for us. They can be simple there, but they're not here. I don't see it working.
So they're going to have to stop it before it spreads.
Exactly.
Public health experts predict that Africa could be hardest hit by COVID-19. They say health systems won't cope. But in the early months of the outbreak, there were few confirmed cases. Some outbreak models predicted that lag because the continent remains relatively less connected to the most affected regions.
Africa would be affected after the rest of the world.
And health officials knew the virus would come.
Any part of the world can be a risk to other parts of the world in this global connectedness.
The delay has given leading African scientists a window to prepare. In January, South Africa and Senegal had the only two labs capable of diagnosing the virus. Now more than 40 countries can test. And recent Ebola outbreaks in West and Central Africa have taught vital, life-saving lessons in quarantine and contact tracing. In many ways, Ebola, a frightening and deadly disease, is not as challenging, though, as COVID-19.
If you're all in a meeting room and you're close together, all those people would be exposed. Ebola, none of them would be exposed. So the numbers get very high. No matter what South Africa does to contain, if everywhere else in the world there are infectious cases, and there's no way you can really completely stop movement of a respiratory illness like this.
That force of infection is powerful. And perhaps all they can do is slow the spread.
So we are clueless, all of us. We don't know what is corona. We just hear from the radio. Corona, I think. Corona has arrived, you know.
Are you worried?
I am. On a serious note, I am.
In Tembisa and across the continent, people are still anticipating the worst. David Mackenzie, CNN, Johannesburg, South Africa.